Okay, so we have a lot of answers in the chat. We have things like blisters, eczema, melanoma, eczema, did I say that again? Skin cancer, malaria, acne, and like the Black Plague and stuff. Yeah, so those are really good answers. All right, Bian, do you think?
Yeah, I think we have some really good answers. I'll let Kelly take over with the overview.
So these are the skin conditions that we're going to be going over today. We're going to be going over acne, which is a condition that happens when follicles are clotted with oil and dead skin cells. Burns, eczema, which you guys mentioned a lot, but this is that causes dry skin or rashes. Hand, foot, and mouth disease, and this is a virus that causes rashes in your hands and feet. Skin cancer, which happens when your skin cells begin to grow abnormally. Rosacea, which is caused by a dilation in the capillaries of your skin. Hives, which is a type of rash. Seborrheic dermatitis, and this is a skin disease that occurs where you have grease glands. Vitiligo, which is a disease that causes loss of skin color, skin allergies, and psoriasis, which is a skin disease that causes recurring reddish patches.
So your skin is composed of the three main layers, the epidermis, dermis, and hypodermis, or subcutaneous tissue. The epidermis is the outermost layer of our skin. It is super thin on some parts of your body, like your eyelids, and thicker on others, like the bottom of your feet. It creates our skin tone and makes new skin cells. The second layer, or the dermis, contains connective tissue and sweat glands. The job of the dermis is to grow hair follicles, help us feel things, bring blood to our skin, and creates oil. The hypodermis, or subcutaneous tissue, is the bottom layer of our skin and is made of fat and connective tissue. It helps control our body temperature and stores fat. So yeah.
Okay, I'm not sure if Benjamin's here, but acne is a long-term skin condition that occurs when your hair follicles become clogged, and they're clogged with oil and dead skin cells, so it primarily affects skin with a relatively high number of oil glands, which includes the face, the upper part of the chest, and the back. So symptoms of this include whiteheads, blackheads, red bumps, pimples, nodules, and cystic lesions, and causes include excess oil production, bacteria, and inflammation. Some risk factors include age. So as we all know, teenagers experience a lot of acne, and hormonal changes such as puberty or pregnancy and genetics, and contact with oily substances can also increase your risk of developing acne. And a statistic is that acne globally affects around 9.4% of the population, and in Western societies, it affects around 90% of people during the teenage year, and it's slightly more common in females.
Okay, hey everyone, so now we'll be diving into hives. So you may be wondering what hives are. I believe it's not really a common term used, but I saw it in the chat. So by definition, hives are usually common rashes. So there are two types of hives, and they're called short-lived acute, which basically means the hives won't last as long. There's another one that's called long-term chronic, which means the hives may stay longer on your skin before it's healed. Okay, so symptoms may include red, itchy bumps that seem to have some volume, as you can see in the photo to the right upper corner. And there's also another term that's called blanching, which is basically when you press on the center of your red spots and it will turn white. So some of the causes that may trigger hives include food allergies, intaking medications like antibiotics, bites from insects or bugs, pollen from plants, bacterial infection, and more. So keep in mind, there are more symptoms out there I have yet to name on here or on the slides. But here are some of the ones that were the most basic and common ones. So you may be wondering how to treat hives. Of course, the best way is to avoid having hives by simply avoiding known triggers. For example, if you're allergic to peanuts, by all means, please refrain from eating them. Another way is to see an allergist, and they might prescribe you or recommend you medications to reduce the symptoms. You can also apply cool cloth around affected areas of the hives and try to work or sleep in a cooler environment, or wear looser clothing that may reduce the symptom and prevent you from having hives. However, it is crucial to remember that anytime you feel severely sick, dizzy, or having difficulty to breathe, please call 911 emergency right away. Lastly, the people who are more prone to hives obviously ranges. Usually people from ages 20 to 40 are more prone to developing hives. In addition, people who have allergies, who are more stressed, have existing infection or illness, or exposure to certain toxic elements, even people who exercise more often may be prone to having hives. I also want to point out that having hives are not too concerning. Sometimes it's normal and it may occur sometime in your lifetime, and it will probably eventually heal over time. So above, on the bottom right, you guys can see a photo of the statistics. Okay, so I hope you guys learned something new and about hives, and I'll be passing on to Emma.
Hello, next up is vitiligo. So what is vitiligo? Well, the color of your skin, hair, and eyes come from a pigment called melanin. Vitiligo occurs when these pigment-producing cells stop functioning. When this happens, patches of skin lose their pigmentation. The symptoms of this skin condition are patchy and loss of skin color, or premature whitening or graying of hair. The exact cause of vitiligo is unknown. However, it could be related to a disorder of the immune system, previous stress on the skin like a bad sunburn, or it could also just be family history. Next up is treatments. Treatment for vitiligo depends on the person and the severeness. One treatment is creams and ointments. However, these might take a long time to work, and they're not best suited for children or adults because their skin tends to be more sensitive. Another treatment is light therapy, which uses ultraviolet rays to help with the discoloration. One more treatment is depigmentation, which slowly lightens the skin to match with the discolored areas. And this therapy is usually used when other treatments don't work. If the vitiligo is not treated, it can spread throughout the skin. However, it's not dangerous or painful, meaning it doesn't itch or hurt or anything like that. However, these treatments might have some side effects. For example, light-based therapies have a possible risk of skin cancer. So when is vitiligo most likely to show up? It can show up at any time, but it most often appears from the ages of 20 to 30. Lastly, about 1 to 2% of Americans have vitiligo, and one fun fact is that Michael Jackson had this skin condition. That's all for vitiligo, and we'll be moving on to psoriasis.
Now let's take a look at psoriasis. Psoriasis is a long-term immune-mediated disease causing skin to regenerate at a faster rate. Normal skin cells grow and shed in a month, but psoriasis causes skin cells to complete this process within 3 to 4 days. Crazy, right? But this results in skin cells piling on the surface of the skin, creating cycles of flaring, which can last few weeks or months, and then either subside for a while or go into remission. There are 5 types of psoriasis, which include plaque, inverse, erythrodermic, pustular, and Goutade psoriasis. Starting off, plaque psoriasis is the most common, causing dry, raised, red skin patches, also known as lesions. Next is inverse psoriasis, which affects areas between the skin folds such as the buttocks and breasts. Erythrodermic psoriasis is the least common, but it can cover your entire body with a rash. Pustular psoriasis is also a rare form, and it creates pustule lesions, hence the name. And lastly, we have Goutade psoriasis, which affects young adults and children, and is usually caused by a bacterial infection resulting in scaling lesions. What causes the immune system malfunction isn't clear, but scientists believe that environment and genetic factors can play an important role. Some triggers include infections such as strep throat, dry and cold weather conditions, and even high levels of stress. Some symptoms include red patches of skin with thick and silvery scales or swollen and stiff joints, And once you have psoriasis, you're more prone to the development of other diseases, such as cardiovascular disease. There are a few treatment options, such as topical therapy or phototherapy, which aims to stop skin cells from growing and to remove scales. Topical therapy is the usage of drugs and ointments such as salicylic acid or retinoids to reduce swelling and inflammation. And phototherapy is another method which involves exposing the skin to a controlled amount of natural or artificial light to treat moderate psoriasis. Lastly, some statistics. Symptoms can begin between ages 15 through 25, and this disease affects 125 million people worldwide, which is 2 to 3% of the world population. Now on to rosacea.
Hello, so now let's discuss rosacea. According to Mayo Clinic, rosacea is a skin condition that causes redness and visible blood vessels on your face. And you can see the redness on someone's faces on the image to your right. So there's some redness on their cheeks, their eyes, their nose, and mostly the center of their faces. People with rosacea usually have redness, swelling of blood vessels, red bumps of pus, an enlarged nose due to rosacea thickening the skin of their nose, and eye issues. Eye issues include dry, swollen, or red eyelids. However, this condition doesn't have a direct cause, and people believe it's passed down or from your environment. Factors like spicy food, alcohol, hot temperatures, certain cosmetic products, or certain drugs can cause your face to become red. Sadly, there's no cure that completely wipes out rosacea. Instead, there are some methods to alleviate the symptoms. Gentle facial products or antibiotics prescribed by doctors may alleviate redness. Lasers or light treatment can help with extreme cases. Most commonly, women, people with damaged skin, people with lighter skin, people over 30, people who smoke, or someone with a family history of rosacea are more prone from getting this condition. Rosacea can be found from less than 1% to 20% of the population. However, we should always take in consideration of various factors that prevent rosacea from being diagnosed, like someone might not check whether they have rosacea, or someone may have darker skin so redness is less visible. So the frequency of someone getting rosacea could be higher. Now, let's move on to skin cancer.
Skin cancer is the out-of-control growth of abnormal cells in the epidermis, the outermost skin layer, caused by unrepaired DNA damage that triggers mutations. These mutations lead the skin cells to multiply rapidly and form malignant tumors. Symptoms of skin cancer include moles or spots that appear to be asymmetrical or irregular, have a jagged border, uneven color, or are evolving as time passes. The two main causes of skin cancer are the sun's harmful UV rays and the use of UV tanning beds. However, if skin cancer is caught early, your dermatologist can treat it with little or no scarring and high odds of eliminating it entirely. One thing that will help decrease your chances of skin cancer is sunscreen. Try to remember to apply every day, even if it's cloudy. Of course, skin cancer isn't incredibly common. However, 1 in 5 Americans will develop skin cancer by the age of 70. Luckily, most won't have to worry about that for at least a couple decades, as older adults are typically most at risk to develop a form of skin cancer than kids and younger teens. Now, let's hear about the treatments for skin cancer.
Types of treatments for skin cancer. Treatments for skin cancer include surgery, chemotherapy, radiation therapy, and immunotherapy. Usually, if the skin cancer is in its early stages and is not an aggressive form of cancer, surgery will be used. The surgeon will remove the skin tissue that has skin cancer. The surgeon could remove the skin cancer by freezing the cancerous area with liquid nitrogen and remove the cancer this way. Another treatment option is chemotherapy. For those of you who don't know what chemotherapy is, it's basically a combination of drugs and chemicals that work to kill cells. If the cancer is localized, a person may use topical chemotherapy treatment, which is essentially a chemo cream. This person would put the cream on the cancerous area and the cream would kill all the cells. If the cancer has spread to the other parts of the body, then more intensive chemotherapy will be used. The next treatment option is radiation therapy. In radiation therapy, radiation waves are targeted at the area which has cancer, so the radiation can kill all the cells. Radiation therapy is often used after a person has had skin cancer surgery, so just to make sure that there are any cancer cells left. Another treatment option is immunotherapy. Immunotherapy is where a person is given medications to boost their immune system. You might be wondering how this will help. In our immune system, we actually have immune cells that are called T cells. These T cells can actually distinguish cancer cells and kill them. So basically in immunotherapy, they're trying to stimulate the T cells and try to kill skin cancer cells through this way. That's all
Yeah, so there's definitely some really interesting treatments for cancer, and scientists are working to develop more. Last session, I think someone asked a question about why people lose hair when they have chemotherapy. It's because chemotherapy targets fast-growing cells because cancer cells divide very quickly, and so that's why. Am I glitching? Oh my gosh. And so that's why your hair follicle cells are really they grow really fast, like your hair grows. So then that's why your hair will fall out if you have chemotherapy. Sounds good?
Okay. So the condition can also lead to stubborn dandruff on the scalp, hair, eyebrows, beard, or mustache. Some other symptoms of the condition are rashes, dryness, flakiness, oily areas, and peeling. It can also make other areas oily, such as the face, nose, eyebrows, ears, and chest. Depending on how stressed you are, these symptoms could become more severe, and they usually flare up in cold, dry seasons. The cause of seborrheic dermatitis is not completely certain, although doctors believe that some contributing factors could be a yeast called Malassezia, which is an oil secretion on the skin. Also, an irregular response of the immune system could contribute. The main treatments for seborrheic dermatitis are medicated shampoos, creams, and lotions. Someone who has the condition usually starts with home remedies such as over-the-counter medications, but if there is no difference, the medications will likely be prescribed by a doctor. The creams, shampoos, and lotions control inflammation and should be used sparingly, or else they will cause side effects. Some other treatments are antifungal gels, creams, or shampoos being alternated with another medication or an antifungal medication that you take as a pill. It is also important to wash your scalp regularly if you have seborrheic dermatitis. Some other home remedies are avoiding styling products, cleaning your eyelids, wearing smooth cotton clothing, and removing scales from your hair. Keep in mind that seborrheic dermatitis is more likely to affect infants before they turn 3 months and adults who are ages 30 through 70. Some other risk factors are neurologic and psychiatric conditions such as Parkinson's disease. In addition, a weakened immune system, recovery from stressful medical conditions, and some medications. Lastly, some statistics that go along with the condition are 11.6% of the general population are affected by it, and about 70% of infants ages 0 to 3 months are affected by seborrheic dermatitis. Next, we'll be talking about skin allergies.
Now we move on to a different type of dermatitis, contact dermatitis, also known as skin allergies. Before we dive into skin allergies, let's go over what allergies are in general. Allergies are overreactions from your immune system to a substance that is typically not harmful, such as shellfish, peanuts, tree nuts, etc. Skin allergies are basically those allergies put on your skin. Skin allergies can either be hereditary or can develop after 10 days within coming into contact with the substance. Much like any other allergies, there are various types of triggers or causes. These include medication, nickel, plants such as poison ivy, latex, chemicals such as cleaning products like bleach, fragrance products, pesticides such as bug spray, sunscreens, and more. When you come into contact with what you are allergic to, the allergic reactions or symptoms will happen. These can be hives, rashes, or swelling. Skin allergies are typically not lethal, but are itchy and can be dangerous if left alone for too long, like any other allergies. Since skin allergies are not a quote-unquote disease, treatments usually only alleviate symptoms. Treatments are typically delivered in a cream, such as hydrocortisone cream, antihistamines, and other ointments. Skin allergies are more common in children ranging from ages 0 to 4. In 2015, 8.8 billion children in the United States had skin allergies. Now we move on to a different skin disorder, hand, foot, and mouth disease.
Now we'll be learning about hand, foot, and mouth disease. Hand, foot, and mouth disease is a virus that affects children, causing rashes in the hand and foot and sores in the mouth. Some causes for being infected by this disease include saliva by sharing drinks or food, skin-to-skin contact such as hugging or handshakes, fluid from other people's blisters, and respiratory droplets through the air, such as being around someone who has this disease and is coughing or sneezing. The symptoms of hand, foot, and mouth disease include having a fever, sore throat, rashes, especially in the mouth, a loss of appetite, painful blisters in the mouth, and feeling irritable or unwell. One should consider seeing a doctor if this disease gets bad to the point where they can't even swallow any fluids at all. There isn't really a treatment for this disease as it usually goes away and resolves itself on its own in about 10 days, but taking pain medications will help alleviate symptoms and make someone with this disease feel better. Hand, foot, and mouth disease is the most common in children under 10, and someone is at risk for it if they've been in any type of physical contact with someone who has this disease. One way to prevent getting infected by hand, foot, and mouth disease is to have good hygiene, such as thoroughly washing your hands and taking showers, and avoiding those who have this disease. That's all for hand, foot, and mouth disease.
Moving on to burns. A burn is damage to the skin tissue that results from overexposure to some kind of radiation or contact. For example, people exposed to radiation like sunlight for too long can get sunburns, which results in redness and peeling skin. Other causes include chemical contact, which is when the skin touches some type of chemical that can be found in drain cleaners and bleaches, and can result in irritation of the skin and blisters. Another is electrical contact, where the skin touches an electrical current, like a socket, can result in headaches and swelling. Lastly, thermal contact, when the skin touches a hot object like a pan that has been heated, can result in white or charred skin. There are 4 degrees of burns that determine the severity of harm caused to the skin. A first-degree burn means that the burn has only affected the outer layer of skin, which is the epidermis. A mild sunburn is an example of a first-degree burn and can be easily treated. A second-degree burn means that the outer layer of skin as well as the layer beneath it, which is the dermis, has both been damaged. Common symptoms of this include red skin that has blisters on it. Third-degree burns are more severe and destroy 2 whole layers of the skin, making it difficult to treat. The skin would turn brown or black in this case, but there won't be a lot of pain since it would have damaged nerve endings as well. Finally, 4th-degree burns are the most dangerous burns that can be life-threatening, as these burns also damage bones and muscles, leaving scars on the skin and possibly permanent change to the color of the skin. Treatments for first-degree burns can be dealt with home remedies, such as placing the burn under cool water for around 20 minutes. Other treatments for this include cool compresses and gently rubbing aloe vera on the area of the burn. Second-degree treatments can be treated with antibiotic cream or ointments prescribed by doctors. However, 3rd and 4th-degree burns require more intensive care since they are more severe. Treatments such as providing fluids that contain electrolytes to help the body heal and daily cleaning to remove dead skin can help. Though this type of burn depends on the severity of the burn, so the person might need surgery, where the doctor could repair its skin damage and perform skin grafts if necessary to cover the burn. Additional therapy can also be required to help the patient with motility if the burn had damaged the nerves. Overall, the severity of burn can vary and cause symptoms ranging from red skin to headaches, making it harder to treat.
Eczema is a non-contagious skin disease that causes your skin to be dry, itchy, and inflamed, and it can start in childhood, adolescence, or adulthood. There are 7 types of eczema: atopic dermatitis, contact dermatitis, neurodermatitis, dyshidrotic eczema, nummular eczema, seborrheic dermatitis, and statice dermatitis. Atopic dermatitis is the most common type of eczema, which begins in the first 6 months of a person's life. It's severe and long-lasting and can be passed down in families. Atopic dermatitis can get better at some times, but other times it continues to get worse. People with atopic dermatitis usually have eczema anywhere on their body, and the rashes can ooze or bleed, which makes their skin more vulnerable to infections. Neurodermatitis usually only affects 1 or 2 places of skin on your body and needs treatment to eventually disappear. Scratching can damage the nerves in the skin, which only makes the itching worse. Eventually, with too much scratching, the skin will become leathery and rough. Neurodermatitis is the most common on feet, ankles, hands, wrists, elbows, shoulders, neck, scalp, and sometimes eyelids. Neurodermatitis usually begins in adults from 30 years old to 50 years old, though some people diagnosed with atopic dermatitis can also develop neurodermatitis. And dyshidrotic eczema causes severe itchy blisters on the hands, feet, and edges of fingers and toes. These blisters have an itching and burning sensation, and when it heals, the skin is likely to redden, dry, and peel off. This leaves the skin under the blisters tender, and that skin can become infected. It is most common in adults from the ages of 20 to 40. And pneumolar eczema causes circular oozing patches of skin and can occur at any age, though it's more prone to affect men than women. Some known triggers are insect bites, chemical burns, and scrapes. Pneumolar eczema can usually be seen as coin-shaped patches of oozing skin on the arms, legs, torso, and hands. And finally, status dermatitis happens when there's poor blood circulation in the lower legs, which causes water and blood cells to pool in the lower leg area. It affects people over 50, and women are more likely to have status dermatitis than men. Some risk factors include high blood pressure, obesity, kidney failure, and more. Symptoms can be itching, scaling, dryness, and a heavy feeling after a long period of sitting or standing. This causes swelling in the lower legs and ankles, which can cause permanent changes in skin and thickening or hardening skin, or a bumpy appearance. And I've actually had atopic dermatitis since I was 2 months old, so I can give you some personal experiences with what this type of eczema is like. So atopic dermatitis can affect people anywhere on the body, and for me, the eczema and rashes are everywhere on my body except my feet and my face. And for me, the irritated skin doesn't always start out as rashes. It's just like a patch of itchy skin. And since scratching sometimes makes it feel better, and I've experienced eczema all my life, so I can sometimes scratch without knowing it, I'll just like rub an itchy part of my skin. And this makes the patches of skin swell up in bumps, which tends to be just as itchy. And other times, if I just scratch it too much, then the skin will start breaking apart and reveal small patches of oozing or bleeding spots, which I'll just have to like put some sort of tissue on to stop the bleeding. And while atopic dermatitis can heal and disappear fully, it can also get worse. So when I was younger, my eczema wasn't as severe as it is now. Such as when I was younger, my eczema only affected my face and kind of like other parts of my body, like my arms. It now pretty much spread to everywhere on my body, including my scalp and my ears. And on especially severe days when my skin is too dry, it can affect my face. So since there's no known cure right now, there are types of treatments that I use to manage my eczema and how severe it is. So every season the weather changes, and that also means that I need to change my skincare routine to make sure that my eczema doesn't get too severe. Such as during the winter months, it's cold, and usually you would turn on the heater in your house because that makes your house warmer. But for me, when I turn on the heater at home, it makes my skin too dry, which increases the severity and itchiness of my skin. So this means that during the winter months, I need to use moisturizers to make sure my skin isn't too dry. And a few years back, my doctor prescribed a topical steroid for me to use. So topical steroids are ointments that can help manage the spread of eczema. For example, the ointments prescribed can be sticky and they're easy to smear. So after applying them, I can't really do much without getting the ointment everywhere. Like even little simple things like putting my arm on my table. Like when I'm wearing a short sleeve shirt, that will spread my ointment all over my desk. And when I'm wearing like a long sleeve shirt, then it'll just like smear all over the inside of my sleeve. So this means for at least a few minutes after applying ointment or lotion, I just have to like sit and wait for it to dry if I don't really want it to get everywhere. And since I've had eczema for almost like 14 or 15 years now, I've gotten used to scratching whenever it's itchy and can sometimes do it unconsciously. So sometimes I'll end up scratching an itchy part of my skin without knowing it until I literally have like blood all over my nails and realize that I've scratched until the rash bled. And it's also uncomfortable because in hotter weather, my eczema will be more severe due to dryness. And during the colder months, when I turn on here, that also make my skin too dry. And I've also had to avoid known triggers since I was a child. And I haven't had my triggers confirmed yet, but some things that I know will make my eczema worse are fruits like pineapples, mangoes, strawberries, and bananas, and also cheese and black pepper. So when I was younger, I was really good at avoiding these things, but now that I'm older and I've like discovered a variety of food, I'm not that great at avoiding my triggers. And another way to manage the growth of my eczema is to usually tie up my hair so that it doesn't like press against my neck and back. And that makes my skin itchy during more hot and drier months. I think eczema also like really made my confidence not that great because I've always been like self-conscious since my eczema doesn't fully disappear. It leaves these dark marks on my skin. And I've always tried to like cover them up with long pants and long sleeve shirts. But I guess I did kind of start building up my confidence when I needed to wear a PE uniform in middle school, which is usually like shorts and t-shirts. So I guess that really did help me manage my confidence. And I think like while I did kind of build it up, I still have a long way to go. And that's it for eczema and my personal experiences. So we started Instagram for the Weekly Med, the medical journal on our website, where you can stay up to date with all the new articles published every Sunday. And we also do have a program Instagram, Youth and Pre Med, where you can see all the program reminders and updates. And that's it for this session. Our next session will be on March 7th at 10 a.m. And we'll be presenting on oncology. We're looking forward to seeing you there, and thank you for coming to today's session.
Yeah, so if you guys have any questions, you can feel free to type it in the chat. We did have some questions about whether you can access the slides. So we are recording the session, so we'll be posting it on our YouTube channel, and then we'll be sending it out through the emailing list. And then we also had some articles on our website that you can access. So we have some on eczema, on dermatology, and on different like skin conditions. Yeah, so our next session, yeah, sorry for the thing. It's gonna be on March 14th. And I believe that's daylight savings time. So make sure to switch the time. Yeah, and then you guys are free to go.
Thank you.
Thank you so much.
Bye.